Thank you all so much for sticking with us through this afternoon. For those of you that don't know me, I'm Sharon Hirsch. I'm the President and CEO at Prevent Child Abuse North Carolina. And what my role today is to thank you all for being here and to kind of give us a charge moving forward, to think about what our next steps might be. I first want to thank all of our presenters today, Dr. Letourneau, Dr. Hill, Dr. Amaya Jackson. What brilliant people, and we're really grateful for taking the time out to really help us pull a lot of different things together here to get us thinking differently about how we respond to this. I also want to thank our planning committee. We had a group that was working on this for a really long time that include Dina Joy from the Child Advocacy Centers in North Carolina, John Fiesel at Redwoods, Carla Betrago, Monica Johnston-Hostler with the Coalition Against Sexual Assault, Sarah Vidrine at NC Child, Cherie Vodika at the North Carolina Alliance of YMCAs, and Summer Faircloth at YMCA as well. And I particularly want to thank John and Summer. You all know that it takes a lot of logistical magic to pull off an event like this, and the two of them did most of it. So thank you all very, very much for making that happen. So I want to thank the YMCA, the Triangle, for hosting us today and for paying for lunch. We really appreciate it. It was great. What I want to talk about now is really, so what do we do and what does this got us thinking about moving forward? It was really made clear today that child sexual abuse is preventable and that our biology is not our destiny. So what do we do with that? As well, our collective failure, all of us in society have failed to focus our attention on research, on policy and programs that prevent the damage that's happening to children's developing brains and bodies when child sexual abuse happens. It's costing all of us an enormous amount of money, as Dr. Letourneau told us this morning, downstream in our criminal justice, healthcare, and other systems. At Prevent Child Abuse North Carolina, our work tends to focus on primary prevention around the protective factors framework. And we're doing that to build the capacity of parents, agency professionals, and communities to support and strengthen families to prevent abuse from ever happening in the first place. And in that context, that work is largely focused on 4 of the 5 protective factors. We really haven't focused on all 5. We focus on knowledge of parenting and child development, which we also know is really important for sexual abuse prevention. We focus on parental resilience, social connections, and concrete supports for families in times of need. But to truly focus upstream on preventing child sexual abuse, we collectively, I believe, have to focus more time and attention in research, policy, practice, and of course then money on building the social and emotional competence of our children. As we leave today, I want to challenge us to think strategically about the roles all of us individually and within our organizations can play, just to really particularly focus on how do we focus on children's social and emotional competence. Building the social and emotional competence of our children must be built on a foundation of good data. Our systems for reporting and tracking child abuse and neglect across the departments of social services, child advocacy centers, and law enforcement aren't as strong as they need to be. They need to be improved so that we know more about the true scope of child sexual abuse in North Carolina. Do we know the average age of predators in our state? Do we know the average age of child sexual abuse victims? Are we looking at the data through a racial equity lens? Do we know the true prevalence of child sexual abuse in North Carolina, or are we just relying on national statistics? We need that information because our policymakers are going to demand it of us in order to make investments. We need it to target interventions, and we need it to measure the impact of interventions and prevention programs moving forward. That means we have to invest in the data systems. So that's challenge number 1. Building the social and emotional competence of our children must begin with our youngest children, because we know that if children learn early about healthy relationships and empathy for others, their brains will be wired for healthy relationships as they grow through adolescence and into adulthood. This can have the win-win impact of children growing up both to resist predators and to prevent the development of predators. We heard a lot about that this morning. To do this in North Carolina, we have to start with raising awareness, both about the issue and the research on what works. Norms are going to have to change. to support investments in programs that focus on healthy relationship skills, including healthy sexual relationships. And that's a tall order in North Carolina. We have to be honest about that. We also heard Dr. Letourneau say today that the evidence base is not as strong for child sexual abuse programming as it is for other prevention programs. We need our research institutions in public health, in social work, in psychiatry to focus on creating interventions and programs targeted to preventing child sexual abuse. And we need the philanthropic community to support pilots and research to see what works. Finally, as Lisa said earlier, I would be remiss if I didn't talk about our individual responsibilities to be a connection. We talk a lot about that at Prevent Child Abuse North Carolina. We know all the research on this is crystal clear. Children that have safe, stable, nurturing relationships with both their parents and within their communities build social and emotional skills. And those communities look out for them. And they're able to identify when kids are at risk of grooming and abuse. So we all have a role to play as individuals, as researchers, as parents, as funders, as policymakers, policy advocates, and policy shapers. I hope you'll take time after today to think really carefully and strategically about the role that you can play and about the role your agency can play in building a system to prevent child sexual abuse. I hope you'll engage with us at Prevent Child Abuse North Carolina. I hope you'll engage with the Child Advocacy Centers of North Carolina. I hope you'll engage with all of us that were involved in planning this program today. We know that this is a tall order and we don't have the answers yet. So as John said, we will be sending you links to these presentations. We're going to send you a survey and we'll be assessing what our next steps might need to be. In the meantime, I want you to know about a couple of things. I want you to mark 3 dates down. We've got some exciting things happening that relate to this work. On November 5th, there will be a big national release of new research related to ACEs that relates to this work. It's being released by the Centers for Disease Control, and we're really excited because the lead researcher on it is our new president at the National Office of Prevent Child Abuse America. She has she's had previously been one of the lead researchers on the ACEs study at the CDC. This research has looked at the 8 leading causes of death in our country, and she has been able to model how many lives will be saved in those 8 leading causes of death if we prevent adverse childhood experiences. It will be a big release through their Vital Signs release on November 5th, so please be looking for it. Those are all the details I have on that study. So stay tuned and you'll get to learn more. On November 19th, UNC-TV is going to do a statewide broadcast of the documentary film Resilience, and there will be a Twitter town hall response afterwards. We really want all of you engaged in that, particularly in helping get the word out as subject matter experts to your networks that this is going to be broadcast, and then to participate in that Twitter town hall afterwards. It'll be at 8 p.m. on November 19th. And then a little further out, there is going to be a statewide convening of ACEs and resilience collaboratives across the state, and that will be held June 9th and 10th in Raleigh. And our keynote speaker will be Dr. Melissa Merrick from Prevent Child Abuse America, who's releasing this big study. So stay tuned for more details about that as well. So with that, I want to say thank you again for being here all afternoon. Thank you for all that you all do in very many different ways in different agencies, different sectors to support and strengthen families in North Carolina. Your participation here was really important. We're grateful for it, and we look forward to continuing to engage with all of you. Thank you all so much for being here.